video, we'll discuss working with people whose primary language is other than English. In this video, we'll discuss barriers to treatment in the clinical setting, as well as specific skills, including use of translation services, and more. We will also provide resources for further knowledge. There are several circumstances in which a clinician can encounter language barriers in the clinical setting. Some examples include working with people residing in insulated communities. This would be areas in which people live mostly among others whose primary language is not English. One example would be the Hasidic population in New York City, which is a multi-generational community where all services, from emergency to education, occur exclusively in the Hebrew language. So it's possible that one may navigate this community without English proficiency. First-generation individuals would consist of people born in the U.S. to parents who immigrated, so they might grow up in households where English is not spoken. Another group are individuals who immigrated from other countries at any age. These individuals may not have had the opportunity to learn English yet, or otherwise live in an insulated community where their needs are mostly met without having to speak another language. Translation is often associated with appointments, but can occur at any point of contact. For example, people may need support or translation during emergency situations, or while coordinating with emergency services, such as police, EMTs, dispatch, domestic violence, or suicidality support services. Translation can also be useful for scheduling first appointments when people call in or walk into offices. Finally, translation can assist in initial and follow-up appointments with clients. Anna is a primary Hindi speaker who was originally mandated to a 72-hour hold by CPEP Mental Health Crisis Services following jumping into a river with suspected suicidality. Upon completion of inpatient stay, she is scheduled for an outpatient therapy appointment, which she is now attending. Anna is not proficient in English, so she attends the appointment with her husband and children. Her husband offers to translate for her. This situation poses a series of issues. First, Anna cannot be offered confidentiality that is required in mental health settings if a family member is translating for her. Additionally, Anna may want to talk about issues happening in her home or life that involves the people attending her appointment, thereby making it a conflict of interest if her husband translates for her. Altogether, this means that using Anna's husband to translate for her would render the clinician unable to provide therapeutic care. The solution to these issues is to use translation services. The first step here would be to coordinate with Anna's family, letting them know that the clinician must speak with Anna alone to render care. It can be helpful to let them know that they can wait in a reception area until Anna's appointment is complete. Once Anna's family has left the room, the clinician can then begin the in-appointment translation process. Once a translator is on the line and has been briefed about the situation, the clinician can let Anna know about her rights to confidentiality in health settings. There are several factors to consider when utilizing a translation service. When using a call-in service, they will typically require a clinician to provide a company ID to verify they have a contract with your organization. It should be noted that some languages being requested for translation services will often have longer wait times and in some instances will require a callback. We will also want to debrief the translator on the nature of the content to ensure they will be okay working with it. Lastly, it's important that we remember to center the client during the translation process. This includes, from the outset, explaining to the client why and how a translator will be used. It is important to maintain eye contact when speaking to the client, even though an interpreter will be relaying the message in the client's language. Similarly, we should look away from the client while speaking with the interpreter. Remembering these important aspects helps maintain the structure of therapy and ensures that other nonverbal communication can be recognized. Lastly, we should remember to keep the client abreast of what's happening during times when we might be collaborating with the interpreter. When working with clients, it's important to note that their primary processing occurs in their language of origin. As such, we should remain aware of the importance of clients speaking aloud in their primary language. In keeping with this theme, we can encourage clients to express themselves in both languages, sometimes going back and forth. See the first example to the right, where a client expresses themselves in Albanian, followed by the interpreter providing the English translation, and ending with the client speaking again in Albanian. Similar to an example in a prior video, we want to use client-centered language as often as possible, and this includes utilizing the actual words and terms they use to describe important aspects of their lives. See the example to the right where the client uses a Yiddish slang word, and the clinician uses the same term going forward. When encountering language barriers in the clinical setting, the process of translation can provide an opportunity to orient clients about their rights and about the healthcare process in general. It can also serve as an opportunity to provide clients with resources, including general information about English as a second language, as well as information provided in their primary language. Here are some additional resources.